posterior cingulate gyrus. In that posterior cingulate gyrus, we are seeing that part only, in that part, in that small box, in that region, what are the metabolite levels? See, if the metabolite means, that's what I was saying, a neuronal cell has its own metabolism. In that, I think NAA is N-acetyl aspartate, the MI is myoinositol, and the choline and creatine. There is increase in the myoinositol and decrease in the NAA, but in the control, normal people, this is the high. That's spectroscopical. This is a non-invasive. Just how you go for the MRI scan, like that only we will go, but we are going to assess these metabolites through these ratios, NAA and MI. These kind of researches are taking place in the neuropsychiatry illnesses nowadays. Only the problem is the cost effectiveness. If you are going with the cost effectiveness, we can't do the single MRS. Once if you do, it's not done because we have to do sequential MRS. So each MRS may cost up to 10 to 12,000 in the current place, like a Gadag or Hubli or somewhere. But if you go for a MRS in a higher places, they are a little costly. But nowadays, since in our center, like in a gyms, we have a MRI and MRS is a free of cost, what they are given. Since we are doing a researches in some sectors like alcohol dependence syndromes with a initial, because if you find it out before the structural damage, before the structural images what we are going to damage, we are going to know the things like a metabolite level only. So we can start a early treatment and prevent the structural damage. And also the severity of the illness is also can be treated. It will not go for the severity and we can treat it early. It will be really beneficial for the patients and also society and a family. And even family members will be, because as you know, a single person is suffering in a psychiatry illness in a family, the entire family will be suffered. It's not like a person is suffering, as it's a known factor. So we are going to, that's why we say we are going not only society, it's a family and others. And it is a productivity also increased. So otherwise, it is national productivity is also helpful. Okay, anyhow, but the cost effectiveness is another factor. Next. That's what I was saying, functional MRI, this is the MRS I have told. Again, this is the functional MRI. This is in the image based only I will going to tell. These are some functional MRI and FTG and PET, both. Like in a PET, positron emission testing scan. In this PET, what we do, the basic principle of this PET scan I will tell you, because you should not be confused. PET scan, we are going to inject some radioactive tracers into the body. After injecting the radioactive tracers, we are going to see which part of the brain, where it is oxygenated. They're like that, PET scan, there is in Alzheimer's dementia, because since neuropsychiatry, so I have taken as only one aspect, that is the dementia, and I am projecting, not a Parkinson's. There are many, like movement disorders and other disorders like ADHD and other, like autism and all. But I'm only concentrating on dementia because we can't control, take all the illnesses and complete in this single seminar. So Pittsburgh compound, what they have told, PIB, and the newer like pemetrexed and flurbitromone, these are 2-3 substances are there. Next slide. So if you see the PET imaging, if you see the images only, you can a little bit understand it. So this is the control subject. The MCI is mild cognitive impairment. MCI2 is again mild cognitive impairment, second, 3, and the next one is AD, that is Alzheimer's dementia. The patient comes after coming to know that it's a memory disturbance, recent memory impaired and immediate memory impaired. After that only they will come to the psychiatrist or the physicians or doctors, wherever. But at that time already this is the damaged. But if you go for a scans, before the symptoms have developed, only mild cognitive impairment has occurred. When we do the MMSE scoring out of 30, if you get a 25 or 24, by that time only if you go for a scan, MRS, we can find it out. We can compare with the control. Where in MCI1 only we can come to know that how when we inject it, this is the red and yellow part is the damaged already. Like that, amyloid already has been saturated. Like the amyloid imaging detects these fibrillary tangles of A beta proteins and plaques. And this, if you scan for above 70 years, just for a PET scan, we are going to see the 30% of the patients with a MCI 1 or 2 or 3. But the patient comes with a 77 or 76 or 75 years with a complete AD. So we can only prolong it. But if you get it in earlier, we can prevent it, or we can hasten the progress of the illness, and we can give a good quality of a life to our patients. Next. So same thing, controls and AD with amyloid bind. This is amyloid binding another material, radioactive materials they have got by that, converted to AD MCI, then no images in the 4 years. You can see this. Next. This, again, this is a FDG with PET. Earlier was a Pittsburgh, that is one of the radioactive tracer. But this is a FDG this the mechanism is again different. That is the glucose metabolism in the brain and the brain activity. How the active glucose metabolism, how much glucose is metabolized in the brain and the brain activity is taking place. So which part of the brain? This is called as the FDG PET, that is the fluorodeoxygenase glucose. In this, we can see really the good indicator to investigate in the Alzheimer's dementia, especially it's a impaired synaptic functioning can be easily detected, and also both MCI and mildly affected ADs show a decrease in the FDG intake. Intake of a decrease in the FDG intake, and also compared to the controls, and early diagnosis transitions from the MCI, mild cognitive impairment and Alzheimer's dementia. If you see these pictures, again, if you go on telling the principles and it's going to be very difficult. If you see it, normal will be how much this fluorodeoxygenase glucose activity. This shows brain activity is more because the utilization of the glucose is more here in the normal. Over a period, mild cognitive impairment is very less. Over a period, the brain tissue utilization of the FDG is very, very less in the Alzheimer's disease. These are the investigations, little costlier, but really helpful. Next slide. These are the basic, that's what I was saying. They are the basic newer advances in psychiatry as a biological psychiatry. They are the imaging techniques. And if you go for the biological treatments, what are the newer advancement in biological treatment if you go? That's what I was saying. Genetic engineering is one of the treatment. By that, they have brought up a newer treatment guidelines and newer treatment modalities, especially. The earlier, yes, psychiatric illness, take a pills, sleep off. Take a pills, sleep. That was a concept. But newer, like, there are multiple drugs have come with a lesser side effects. That's what the improvement in the psychiatry is. If you go for a US FDA approved, Food and Drug Administration approval, more number of drugs are coming up in recent years with a modality of one in a anti-cancer drugs and psychotropics compared to other branches. If you see the newer drugs, like recently last 2-3 years, many drugs have come up. Like if you see the brexanolol, the postpartum psychosis, postpartum depression. This is newer drug. It's a very good drug, very less side effect. It's not going to secrete in the breast milk. And next, pimavanserin. Pimavanserin is another drug like a Parkinson's with a psychosis, where it is not going to act on a dopaminergic pathway. This is a drug which will help in giving a good drug, very less side effect. It is not going to affect for the Parkinson's disease as per se. So Parkinson's with a psychosis, pimavanserin, lurasidone for bipolar and schizophrenia, and cariprazine is a very newer drug which is also for the schizophrenia, and bupropion and dextromethorphan. As you know, dextromethorphan almost have heard. Dextromethorphan is an antitussive drug as a cough for the dry cough, what they will use. But this is the combination with the bupropion as a NRI, norepinephrine reuptake inhibitors. With that combination, it's one of the best drug which is helping right now for a major depressive illness. If you give like a SSRI, SNRIs and other drugs, they used to take 3 weeks, 6 weeks or 8 weeks to improve the symptoms of a depression, major depression. But 5th to 6th day only we can improve the symptoms with 25 to 30% of the symptoms will be reduced. So we can prevent the suicidal deaths, because which can be easily preventable illness. And then like this psilocybin and some more like cannabis for the schizophrenia. Like that multiple drugs have come up in recent years. This is 2024 list of, this is xanomeline and tropsium is a 2024 released FDA approved drug for the schizophrenia. And modalities, as I was telling, earlier every day they have to consume a drug. Now the changes, like new advantages like take a drug only once a week. They are maintaining well with a schizophrenia. Take a one drug, that is more than it. Sunday drug, Sunday pill, they will call it as a Sunday pill. Take a one drug, that is done. Next Sunday only they have to take. Some more drugs have come, paliperidone injectables and all. They have come already 10, 15 years back only. It's not very recent, but that kind of injectables they are there. Very less side effects. They can maintain the schizophrenia, patient with a schizophrenia, take one injection per a month. Only once. That too IM, gluteal, deep muscular injections. Once if you give it, after that will be stored in a fat of a muscle. So it will be daily releasing into the muscle, and it will be helping for the antipsychotic. Paliperidone injections, olanzapine is also come with a depot injection. They are called as the depot injections. And some more are there. They are called as, some strips have come. Suddenly if the person with a, I can say, what is this, kind of a migraine headache, suddenly it has to be observed and the migraine headache has to come down. There are rizatriptan, newer drug. You put a simple like a small film. It will be 1 centimeter into 1 centimeter. Keep on the tongue or the below tongue. Just release. As it releases, within 15-20 minutes, the symptoms will come down. Migraine symptoms will come down. So like that, the sildenafil, okay, to say it as sildenafil strips also has come. Pantoprazole and domperidone strips has also come. Like that, there are many research advantages are there. They're like nicotine replacement therapy for the nicotine dependence. For them, another strips are there. So just attached to a transdermal patches. You give it for the attached to a dermal patches. If you put that patches, there's more than that. That will be go on releasing some nicotine. That is for 24 hours patch, 48 hours patch, depending upon the doses, 7, 21 and 14 mgs. Okay. Next, like brain stimulation techniques. Okay, before that. This is the biological treatments, again with the brain stimulation techniques. What are earlier, as you know, we will give a current therapy, that is ECT, electroconvulsive therapy. They will give a shock treatment. That is there, still it is there, but it is a modified electroconvulsive therapy. That is still we are practicing in our institution. But brain stimulation techniques like magnetic stimulation techniques, that is without any invasive techniques. There is no invasion in this. Repetitive transcranial magnetic stimulation. By giving two magnetic electrodes, by producing eddy currents, we can give this session-wise, 10 sessions, 12 sessions, 14 sessions, every day, daily 2 times. No drugs, like the people who are asking, no? Most of the psychiatry, psychotropics are giving a lot of side effects. So these are the newer techniques. There is no decreased use of drugs, very minimal dose of drugs, along with that TMS, repetitive magnetic stimulation techniques. But yes, they are Affordability is the another next choice. But initially, these machines were lakhs together than crores. But as the technology is developed, even the machine rate has come down. The session rates are also come down. Initially, only we used to get these repetitive transcranial magnetic stimulation at only at the places like metros, Bangalore and Chennai, Delhi and all. But now it has come till the Hubli also. Still, we don't have a RTMS machine at Gadag as per se. So session-wise, they are charging. Each session, it will be this much, 2,000, 3,000 rupees, like that. Like TCDS, transcranial direct stimulation techniques, and MST. Again, magnetic seizure therapies. By giving the intense magnetic stimulation, they are going to produce the seizures, and then by that seizures, the symptoms will be come down. The magnetic seizure. Invasive. Another invasive like deep brain stimulation. Like subclavius fossa, as you know, this is the free space where they can place a lithium batteries, and by that they will also put some connected with the electrodes. These electrodes will be some small neurosurgical procedures they will conduct and place it in some of the lobes like a frontal lobe, temporal lobe, or the deep brain structures. These will be automated, and that processor is being placed, and that chip will be giving intermittently. As we adjust that will go on giving the current to the deep brain stimulation. These will be used when there is a treatment-resistant illnesses in the psychiatry. DBS is invasive DBS is also a treatment of choice. Other than that, psychosurgeries. This is already old, like the singulectomy, the simple part of the brain is surgical, where like in a treatment-resistant OCD and all. Okay, this is not a recent, that is not a recent psychosurgery and all, but these are the stimulation techniques of the surgery. Okay, current and past, what we are using. We can see with this slide, if you go for the neurobiology, there is a chemical imbalance. This is in the currently what we are chemical imbalance and psychological factor. Due to that, the illness is occurring. But advances is functional neuronal circuits and the biological markers are the next future. Next, brain imaging. Okay, back. Brain imaging like a CT brain, MRI brain. This is the structural brain imaging, but it's going to be next is like fMRI, MRS, PET, SPECT, and MPG, and the functional brain imaging. Genetics, if you go, earlier they were called as adoption studies, family studies, and twin studies. But now in genetics it is going to be a linkage analysis, genome-wide acceptation, association studies, epigenetics, and the human genome projects, genetic polymerase. Next will be the, wait. Stimulation techniques, earlier only the electroconvulsive therapy, that is modified, but now it is going for the magnetic TMS, TCDS, and MST, invasive DPS. And the drug delivery system, oral drugs, but now depot injections, and I forgot to tell about the implants. We can place it underneath of the skin, we can put the implants of our drugs. It will be go on releasing the dose of a treatment. There is no need to take a everyday pill, because if you miss the day of pill, they will not have a good sleep, or their cognitions will be lost and their behaviors will be changes. But implants are really helping, digital pills and transdermal patches. And if you go for the psychosocial factors, like earlier like a CBT, DBT, and REBT, and abuse, and these are the correlations, these are the counseling factors. But if you go for the counselings, now again it is changed. ACT and mindfulness-based cognitive behavioral therapy and metacognitive therapy, AI-based and machine-based learning. Again, artificial intelligence and machine-based learning is coming up with a counseling part and legal protection, advanced directives. Okay, this is the basic slide. What are the current and past and the advances taking place in the psychiatry as such, in neuropsychiatry? Okay. I think if you go for the illnesses as per se, I think I have a time or not, I don't know. If you go for because why I have taken as a depression is a part in this slide I would like to explain, because majority of the illnesses, neuropsychiatric illnesses like a dementia or Parkinson's. Depression is almost everybody know, and also most commonly is having a problem in the society. If you go ahead with all this, again, neurotransmitter level, biological molecules levels, if you go next. So these are the genetics, like NRC, NR3C1. If you go in detail, these are the genetic. Then next. Same things, whatever I have explained, BDNF and all, but specific to depression, like specific to schizophrenia, specific to bipolar, specific to child psychiatry issues, specific to geriatric psychiatry. There are all the, everything is, the researches are taking place, and the treatment aspects and modality and newer drugs are also coming up. Okay, next. Okay, next. This is only for depression. If you go for the next, last slide, you can go. Okay. Wait. Next. Before that. Okay. Specific to depression and other like psychotherapies, what are the advances, third wave psychological therapies? Earlier there were counseling, family therapy, couple therapy, and this cognitive behavioral therapy, dialectical behavioral therapy there. But in therapies also, psychological aspect also, therapies also structured have been changed. They are acceptance commitment therapy, then compassionate mind blowing and metacognitive therapy, behavioral activation therapy, and mindfulness based cognitive therapy, positive psychotherapy, AI based therapy, and machine based learning. There each is a very huge topic, and especially newerly, like AI based therapies are, the people are still stigmatized in our country. Still they are going, and they are very accessible to the cell phones and gadgets. So they are going with AI based therapies and also machine based learning. There is so many apps have come, and so many websites are there, so many institutions they are running with AI based learning. There is no human is involved because the people are still stigmatized in our country. That is like, and also lack of professionals and professional busy. The people are not giving, because time. The AI can give a 24 hours service, but a human cannot. So the people are also not having a time. They can, whenever they are free, they are taking a help of AI, and they are going for these therapies with AI-based and machine-based therapies. These are the basic advances in neuropsychiatry, treatment, diagnosis, in multiple neuropsychiatry illnesses. So I think my time is also up. You can ask any questions. The floor is open.
The session is open for discussion. I ask all the audience to ask questions or write it down on the chits passed to you and hand it over to the volunteers.
Okay. Okay, it's not only on the, you can ask any questions on psychiatry even, not only the recent advances or the diagnostic criteria or the treatment or management. So if the absence says that, I think everybody is understood, or nor the way otherwise not understood. What I can guess, still I feel that I should be a positive motivation. Yes, everybody has understood the topic, I guess. I tried myself to simplify it how much ever possible from my side with my knowledge. Thank you. Thanks a lot.
Thank you, sir, for illuminating us with all the recent advances, helping us for diagnostic and management in the neuropsychiatric disorder. I ask you to grace the chair on the dais, sir. Let us all acknowledge and applaud our speaker for his remarkable contribution and enlightening us. I request Dr. S.N. Belwadi, sir, Dr. R.V. Shettar, sir, Dr. S.K. Hirimat, sir, and Dr. Jairaj Basrigidat, sir, to felicitate Dr. Jitendra Mughali, sir.
Hello.
As we are near to the end of the today's scientific session, we want to leave you with a thought. The real power of an conference lies in the connection that we make together and the knowledge we take away.
Remember, today you have not only learned from experts, but also from each other. You have shared ideas, asked questions, and sparkled new thoughts.
The journey of learning does not stop here. It continues every day. And I hope you will leave this conference with a new perspective and enthusiasm to apply what you have learned. I request all the presenters of this hall to be ready. Shortly we'll start the presentation.
The oral presentations will be started shortly. The list is as per Dr. Santosh Kulkarni will be the first presenter. Second, Dr. Mukund M. Kulkarni. Third, Dr. Shweta Nayak. Fourth, Dr. Navneeta Sen Gupta. Fifth, Dr. Nandini R. Sixth, Dr. Rashmi B.M. Seventh, Dr. Lata L.U. Eighth, Dr. Ranjita B.M. Ninth, Dr. Yadu Gopan. 10th, Dr. Anagha D.N. 11th, Dr. Divya Nagari N. 12th, Dr. Saumya Kulkarni. 13th, Dr. Chaitrika. 14th, Dr. Abhishekhar Gone. Kindly be present here.
Oh. I once again cordially welcome everyone for the oral paper presentation. I would like to take this opportunity to welcome today's chairperson, Dr. Vijay Kumar D. I request Dr. Jairaj sir to escort Dr. Vijay Kumar sir on the dais. I also request Dr. Adu sir to welcome Dr. Vijay Kumar sir with a bouquet. I request the audience to give a round of applause to Dr. Vijay Kumar sir.
Dr. Vijay Kumar Dandavati Mutt, he has completed his BMS graduation from KLE Ayurvedic Medical College, Belagavi, post-graduation in Panchakarma from Government Ayurveda College, Trivandrum. Presently, he is working as professor, Department of Panchakarma, TMAEC Ayurveda College, Hospete. He is a member of HSSC Sub-Council for Skill Development in Ayurveda, Ministry of Ayush, and he is the member of expert panel in ongoing national project on standardization of Basti Karma.
Rules for the presentation. Each presenters is allotted with a time duration of 4 + 1 minute. At the end, best presenters will be awarded, and the judges' decision will be the final.
I request the first presenter, Dr. Santosh Kulkarni, to start his oral presentation.
Good afternoon to all. I myself, Dr. Santosh Kulkarni. It gives me immense pleasure to present paper on this Manaswini-24. As a teacher of Rashastra, as I have involved for many years in the preparation of Sneha Kalpana, and in clinical practice also I have seen the effectiveness of the Sneha Kalpana. It made me to present this particular paper under the title Pharmacological Understanding of Sneha Kalpana in the Management of Neuropsychiatric Disorders. Due to time restriction, I will be very much concise in my presentation. Next slide. So neuropsychiatry disorders, it is a broad term, neurology and kind of psychiatry. These are nothing but the cerebral disorders which are, please change the slide. These are the cerebral disorders which are causing psychiatric symptoms, can be considered as neuropsychiatry disorders, and these will be having the symptoms like impaired brain function, emotion and mood disturbances, which can be compared to the Dhriti Smriti Vibrastam, like that in Ayurveda, and the diseases manifested by this, these are as per modernized depression, anxiety, autism, bipolar disorders, schizophrenia, and different other diseases. Next. And as per Ayurveda, the Unmada and Apasmara like diseases, Nidana and Samprapti, if we think with respect to Charaka perspective, the Manodoshas, Raja and Tama are involved and traveling through Manovasrotas and located in the Hridaya causing the disease. But here the one practical problem arises is in the diagnosis and the treatment of neuropsychiatric disorders, we are considering brain and CNS system. So for that we also get justification as per Bela Samhita as the seat of Manas as Shirastalvantargata Manaha. And according to Ayurveda, the neuropsychiatric disorders can be considered as Unmada, Apasmara, Tattva Abhinesha, Grahabada, etc. Next. And for the management, Snehana is stored as first line of treatment, and in Snehana, Gritakalpana are mainly mentioned in the classics, which are prepared mainly by using Grita as a base and active constituents like Medya, Rasayan and Smritivardhaka drugs. And now the main objective of today's presentation is how these Sneha Kalpana are effective in the neuropsychiatric disorders. So I want to try to explore pharmacological actions of snake kalpana. Next. So if we go through alone Charak Saita, about more than 14 to 15 preparations are mentioned in the snake kalpana, like Hingvadigrita, Kalyanagrita, Mahakalyanagrita, Mahapaishachikagrita, Lashunadigrita, 2 types are mentioned. Next Panchagavyagrita, Mahapanchagavyagrita is mentioned. Next, next slide. Brahmi Grita, Vachadi Grita, and Yamakasneha is mentioned, which is a combination of Grita and Taila with Jivani Agana drugs, and Amlakyadi Grita, Madhukadi Grita, Purana Grita, maybe more than 10 years. Like that, different references of Grita in the treatment of Unmada, Apasmara will get in the class 6. And due to time restriction, I would like to discuss about 5 to 6 Grita pharmacological action. Next. So first one is Panchagavya Grita, main ingredients. Dashmula, Gogruta, etc. 24 drugs are there, and the dose is 6 to 12 grams, up to 2 to 4 months it can be given. Main indications are Unmada and Apasmara, and the pharmacological description, what I can consider is mainly due to its ability to penetrate the target tissue, and it is having ability to destroy the Mastishkagata, Ama, Visha, Krimi, Kapha, which are the pathological factors according to Ayurveda, and it is useful in the acute and chronic conditions. Or it can also be considered a Lina Dosha Nashaka, and Mana and Indriya Vikriti Nashana will be there by usage of the Panchagavya Grita, and it is also going to relieve the tension. Next. Next is Brahmi Grita. It is mainly Brahmi Swarasa and other drugs. Dose is 6 to 12 grams. And the indications will be Unmada, Apasmara, and one more interesting indication is Vandyatva, that is infertility disorders, and the relation between the neuropsychiatric disorders and infertility and their management. Brahmi Grita we can use, maybe due to pituitary gonadal axis action. Then pharmacological description is it is having capacity to remove the Mastishkagata Sanchita, Ama, Mala, and Kapha, which is considered as Mastishka Shodhana. It is the newer concept told in the Rasatantra Sara Siddha Yoga Sangraha, that is very important in the treatment, and it is also helpful in the treatment of epilepsy which are caused due to the infections by removing the toxins. And in the initial stage of Apasmara, if we try it with snake, Vairechnika Nasya, it is going to be very much useful, and it is also helpful in the memory and concentration improvement. And the main phytochemical constituents of the Brahmi are responsible for its effectiveness, that is bicoside A and B. And one more precaution we have to take during the usage is in poor liver function patients we are not supposed to use, or if you are using, it should be cautiously used. Next. Next is Kalyanaka Grita and Mahakalyanaka Grita are also being highlighted, contains about 28 drugs. And Kalyanaka Grita, research work suggests that it is having a nootropic and neuroprotective action, by which it is going to be a very promising medicine in the treatment of neurodegenerative diseases like Alzheimer's disease. And next is Kushmanda Grita, main very few ingredients, Kushmanda Swarasa, Estimadu and Gogruta. And here it is also Smritivardhaka Rasayana and having indications like that. And one important information I want to share about this is one animal study has been done in our college under my guidance, and it has shown a very good anti-convulsing effect in the higher dose, like 2400 mg per kg body weight. Next. Next is Hingvadi Grita, and it is also having Savarchalavana, which is interesting ingredient. In the animal experimentation, Hingvadi Grita has displayed a potential antidepressant effectiveness, can be compared to standard drug, and each ingredient of Hingvadi Grita are having CNS activity, like Grita is Pritivardhaka, and glutamine of the Grita is having synaptic action, and Hingu is anticonvulsant, Shunti is antidepressant, Maricha is anticonvulsant, like that, so on. And Savarchalavana is having sodium ions, which will helpful in the generation of the electron potential. Next. So discussion about the pharmacological action of the Grita Kalpana. Mainly the Samanya Siddhanta can be considered here, that is the similarity between the Matulunga Majja and Grita with respect to Guna. And Grita is also having Samskarasya Anvartana property, which is helping to potentiate the preparation. And Grita is Yogavai in nature, which can be compared to lipophilic action that will that make the Grita to enter the cell very easily, cell permeability. And Grita is also having a blood-brain barrier crossing capacity, which will helpful in the penetration of the drug. And Grita or snake alpanas are having nootropic. Nootropic are considered as smart drugs which can affect the cognitive and higher brain functions, and a neuroprotective effect will be there. And the usage of the keto diet and Atkins diet is mentioned in the management of apasmara, especially in the children group, which contains high fat diet, which indicates the importance of sneha in the management of neuropsychiatric disorders. And moreover, these snake kalpanas are free from the side effectiveness of the modern drugs like sedative, like that. Next. Next. Conclusion. Grita is having sattva guna and can regulate raja and tama guna. And Grita kalpanas, due to their lipophilic, nootropic, neuroprotective action prepared by Maidya Rasayana and Smriti drugs, are very effective and safe formulation in the management of neuropsychiatric disorders. And scope for research is there in the effect of snake alpana in the generation of electric signals and conduction of neurotransmitter level at CNS level regarding the Grita kalpana. With this, I want to end, and I thank the organizers for this opportunity. Thank you. Next.
Thank you, Dr. Santosh Kulkarni, sir. Sir, kindly wait. Judges, please note, the time taken by the first presenter is 7 minutes 59 seconds. I ask Dr. Vijay Kumar, sir, to appreciate the first presenter with a token of appreciation. The next presenter is Dr. Mukund Kulkarni.
Hello.
You may start, sir.
Hello. Hello. Namaste. My name is Dr. Mukund Kulkarni. I'm not a homeopathic or Ayurvedic practitioner. Hello. I'm not a homeopathic or Ayurvedic practicing doctor. I'm a technical person. I'm working as a chartered engineer for last 50 years. But out of love and respect for Ayurveda, I have done my PhD in Vedic sciences. My topic here today is regarding the inference of Acharya Charaka for pharmaceutical aspects of neuropsychology in Sattva Vajay Chikitsa. Am I audible? Yeah. Here, next slide. Actually, Sattva Vajay means conquering the mind or conquering the self. It is the self-control. Actually, Sattva Vajay is ahitebhyo arthebhyo manonigraha. This is what the important parameter of the Ayurveda. The Atmendriya Sanyoga is the principal cause of the disease as explained in Ayurveda. The Ati Hina and, I'm sorry, I'm getting little. Ati Hina and Mithya Sanyog of Padartha is a problematic thing for mind, which affects the function of the mind, that is Chinta, Vicharya, Dheya, Sankalpya. This is what has been discussed in this platform during the last 2-3 speakers they have given the next slide. The goal of Sattva Vajay Chikitsa is, of course, non-pharmacological treatment. Then it is the promotion of Sattva Vritta, that is the code of conduct. Then Ayurveda recommended lifestyle, which is Dinacharya and Ritucharya, method of Manonigraha and Ashtanga Yoga, that is asana, yama, niyama, asana, pranayama, etc. Next slide, please. Next slide. Actually, the research that I have done here is studying the inference of Acharya Charaka in Charaka Samhita, chapter 7, Unmad Nidan. Actually, the last five shlokas which have been given by Acharya, they are very important. 19, 20, 21 and 23. This is Naiva Deva, na Gandharva, na Pishacha, na Rakshasa, na Channe Swayam Klishtam Upaklishanti Manavaha. The word Swayam Klishtam Upaklishanti Manava is very important. It is the next one, he says, Yetvena Manuvartante Klishyamanam Swakarmanaha. Klishyamanam Swakarmanaha. The person is getting affected because of his own karma. That is what the next point he has stated. Therefore, okay, so, sorry, actually there was a lot of disturbance in this, therefore there was a problem. It was not possible for me to operate with this. Now, I will repeat this. These are the five important shlokas from which I have concluded my inference. The inference is the Acharya Charaka has concluded conclusively that there is no pharmacology required because it is the training of the mind. It is the Indian philosophy of life. It is the spirituality and Ayurveda in which he has mentioned this particularly. Now, Nachanne Swayam Klishtam Upaklishtanti Manavam. This is one of the important teach that he has given to us. Then he says, Yetvena Manuvartante Klishyamanam Swakarmanaha. Swakarmanaha is the problem which one doesn't understand, because of which there is no siddhi of the hetu and there is no kritakrityata. Therefore, Klishyamanam Swakarmana. Swakarma must be very good. Then Prajna Paradha Samute. This is one of the important parameter he has stated for non-pharmacology. Prajna Paradha Samute. Prajna Paradha can be of two types. Either it is Atman or it is of Karmaja. But you cannot attribute the blames to Devan, Pitran, Api Rakshasan. For nobody you can attribute those blames. Atmanam Mainayat Kartaram Sukhadukhayoho Tasmat Shreyaskara Margam Pratipaddate. This Shreyaskara Margam is a very important word stated by Charaka. What is the Shreyaskara Marga? Shreyaskara Marga is behave properly. Use Ayurveda recommended treatment, use proper diet, maintain the behavior standards. That is the Shreyaskar Marga he has said. And he has explained what is Shreyaskar Marga. Devadi Nam, Patiti Hitanam, Chopasavana. Devadi. Who is Adi? Adi is Guru, parents, teachers, all elders. Respect everybody. Patiti Hitanam. So, the Ayurveda recommended lifestyle, Ayurveda recommended behavior standards, eating habits, and respecting people. These are the Chopasanam. These things, the bad deeds or misdeeds done by a person cannot be undone. But these things can be used as antidote to the thing because of which you can definitely conquer the things. Next slide. Ayurveda has given three: Shuddha Tattva, Rajas Tattva, Tamas Tattva. Tamas and Rajas, they are prone for this thing. But Shuddha Tattva, there is no possibility of mental disorder. Therefore, Charaka wants everybody to come to Shuddha Tattva. Next. Next slide. These are the recommended lifestyle. It can be withdrawn from, downloaded from Charak Samhita. Next. Thus, the Charaka has inferred everything. Thank you very much. Thank you.
Thank you, Dr. Mukund Kulkarni, sir. We are glad to have you here, someone outside from the Ayurvedic faculty. Judges kindly note the time taken by Dr. Mukund Kulkarni is 6 minutes, 6 seconds. I request Dr. Vijay Kumar sir to appreciate Dr. Mukund Kulkarni sir with a certificate. I call upon the third presenter, Dr. Shweta Naik, onto the dais.
Namaste one and all. Today I am going to deal my topic, Rasaushadhi practices in neuropsychiatry with special reference to the Parkinsonism. All of you know that Parkinsonism is a clinical syndrome characterized by the symptoms of the Parkinson's and along with the other symptoms. And it has a slow movements plus with stiffness, walking difficulties, balance problems and tremors, and also it has the other symptoms like mood, thinking changes, speech problems. There are types of Parkinsonisms are there. Parkinson disease, which tends to improve along with levodopa. Atypical Parkinsonisms improve less or not at all respond to the levodopa. Secondary Parkinsonism do not respond with the levodopa. So today I will discuss with a case which consulted in my clinic, a Parkinsonism characterized by, next slide, a 68 years male patient with complaining of the tremor in both hands and which aggravated the resting, slow body movements and the activities and decreased in the handwritings. So when they met in our clinic, the present history that since 6 months the patient is having slowly the tremors in the right hand and the handwriting sizes are reduced, but the patient neglected. Then few months the patient again aggravated all the symptoms. Later the patient consulted to the allopathy physicians and they diagnosed this is a Parkinson disease stage 4 and they advised the Syndopa tablet for 6 months. But after taking the Syndopa tablet, the patient having a difficulty or uneasiness, that's why the patient stopped and they visited to Ayurveda Panchakarma clinic. So by seeing that past history, there is a known case of hypertensive, diabetic, no other history of the IHD, trauma. Family history, no any histories are recorded. General examinations are in normal limits. Even in the personal histories, the disturbed sleep and constipated bowel noted. Blood investigations are normal limits. Even in a systematic examinations, in a CNS examination, higher mental functions are intact. In the cranial nervous systems, motor system, muscle movements coordination is poor. Finger to nose test unable to do because of the tremors. Involuntary movement, resting tremors were present and micrographia is positive. So the patient were treated initially along with the Panchakarma, and the importance of the Panchakarma I will discuss with later. So initially we started the Sarvanga Habhyanga with the Balashvagandha Taila and Dhanyamla Dara for 14 days. And we got the result that there is a gradual changes in a tremors within 3 days. And the Matra Basti along with the Balashvagandha Taila, there is a generalized increased strength. And the Mustadi Rajayapana Basti for 15 days, the clinical symptoms like resting tremors were markedly reduced. The second setting after the 2 months, we started once again a Shodhana procedure like Sarvanga Kaya Seka with Mahanarana Taila for 8 days, Sarvanga Sthanika Shashtika Shalipinda Sveda for 8 days, and the Matra Basti with the Indukanta Grita. So we saw the fine gross movement, the changes, generalized increase the strength, and even the Vatahara symptoms are started to changes in mild, but no significant changes in the posture. Later, we started with the Shamana Chikitsa with our Rasaushadis. Like initially, we started the Kapikachu along with the Panchakarma procedures. Later, we started the Kampavatari Rasa, what it is available in our area, that Bhairanath companies. We started the 1TID, then Capsule Neuron, which is a Green Remedies company, which contained the Brahatvata Chintamani Rasa, 1TID, and Saraswata Rishta with gold. So by using this, we got the changes in observation, swaying while walking reduced the tremors, slowness in the body movement, and even the reduced anxiety and the depression, because the patient is complaining the hallucination symptoms, like the patient is telling somebody is stabbing on the back. So this complaint is there. That's why we advise the Saraswata Rishta with gold. Next. So coming to the discussion, already you know the Kampavata is correlated with the Parkinsonisms. So control of Vata is a line of treatment of Parkinsonisms. So Shrotasuddhi, Vatanolomana, Rasayana is a general treatment of Avarana. So as per the Rasadarangini, he mentioned in the 7th chapter, 79th shloka, that before starting the Rasayana therapy, there is a need of Kshetrikarana is nothing but a Shodhana therapy, that Panchakarma we should apply. Then only whatever the Rasaushadis are given, that will be act as a Amrita. Otherwise, without Kshetrikarana, if we advise, the ingested Parada also will act like a Visha. That's why we opted the Shodhana treatment initially. And already you know that the Abhyanga will strengthening the muscles, Pindasveda will reduce the stiffness of the body, and the Kampavata need a rejuvenation therapy. So the Basti promotes the Bala Mamsa, even the Shukra, and it acts as a Rasayana, Balya and Vrishya. Matra Basti helps to control the, reduce the tremor as well as the stabilize the Vata dosha. Next. So already the Kapikachu is act as a Vrishya, Rasayana, Balya. Kampavatari Rasa is a Khalviya Rasayana. Mainly it contains the Rasasindura and the Tambra Basma. And Rasasindura is Deepan Pachan Laguguna. It reduces the Anga Gauravata. Rasayana, it suppresses the neurodegenerations. Tambra Basma, if it is used as a toxic or the ashodita, definitely it causes a tremor. But the Tambra Basma as a incineration, it will definitely help to control the Hasta Kampa as well as the Griva Kampa. The neuron capsule, I said that it contains a BVC, improves the sensory and the motor performances. Vak Shuddhikara, Vatashamaka Balya, Mastishka Balya, Medya, Saptadhatu Poshaka as well as Rasayana. So Shamanoshadhi, once again I told that Saraswata Rishta with gold, it acts as an antidepressive, neuroprotective. So coming to the conclusion that I said, the goal of the treatment, we started with the Panchakarma, because along with the Panchakarma, our Rasaushadhi will work very easily and quickly the responses we'll see. So that's why there is a need of Shodhana. As the Shushruta Chikitsa Sthana, he said, Vatascha Pittascha Kafascha Samsarga Sannipataja Doshaha. That Basti is a Sadahita, Shodhana, Shamana and Brahmana, Vyadhihara. We can use in all the, starting with the Bala, that is childhood, and also we can use this in old age conditions also. Rasaushadhis is very palliative, effective in a low doses. So it is already the Samskarita Rasaushadhis, which gives the faster assimilations, and our Rasaushadhis also will be act on the CNS. So this, after using this Shodhana and Shamana, we got a very good improvement in present conditions, and the patient is doing his normal activities. So there is a further scope that if this same research, if we are trying in a larger group, so definitely along with the Shodhana, our Rasaushadhis will work very nicely. Thank you, one and all.
Thank you, ma'am. Judge, kindly note the time taken by Dr. Shweta, ma'am, is 7.34. I request Dr. Vijay Kumar, sir, to appreciate the presenter, Dr. Shweta Nayak, with a certificate of appreciation.
I request the presenters try to maintain the timing.
I request the next presenter, Dr. Navneeta Sen Gupta, to start her session.
Good afternoon, one and all. I am Dr. Navnita, and the topic of my presentation is conceptual interpretation in treatment of neuropsychiatric disorders with specific correlation to Yukti Vipashya Chikitsa and Ayurvedic approach. Next slide, please. Next slide. So according to the WHO, the health is defined as not merely an absence of any disease, but it is a complete well-being of the social, mental and psychological well-being. So as we all know that the Vyadhis has been classified into two types, that is the Sharira Rogas and the Manasik Rogas. So next slide please. So here I have got to know the introduction, that is the neuropsychiatric disorder is a blanket medical term that encompasses a broad range of medical these conditions like Parkinson's, epilepsy, Alzheimer's, stroke, multiple sclerosis, and lateral sclerosis, etc. Next slide, please. So the main reasons why this occurs as a neuropsychiatric disorders, so it has been because of the imbalance into the cholesterol metabolism, blood-brain barrier impairment, it may be, genetic dispositions, other diseases, some neuronal this injury and cell death, and abnormal inflammatory response. Next slide please. So in the Ayurveda, we can make a correlation that Manas is the seat of the Hridaya, like Manas is staying at the Hridaya. So here we can make out that the doshas which are involved in the Hridaya are the Vyan Vata as well as the Avalambaka Kapha. So in that correlation, we can make out that some of the neuropsychiatric disorders and the neurodegenerative disorders can be correlated into this form, like Nanatmaj Manasik Vikaras, Sharira Mano Adhishtit Vikaras and Mano Sharira Adhishtit Manas Rogas. So Chitta Udvega, Vishada, then Brahma, Tama Pravesha, these are Nanatmaj this Manasik Vikaras. Sharira Mano Adhishtita are Manas Vikaras like psychosis, epilepsy, psychic perversions like Atata Abhinivesha, and Mano Sharira Adhishtit Vikaras are Apatantraka, Apatanaka, Sannyasa, Kamaja Jwara, Krodhaja Jwara, Bhayaja Atisara and Shokaja Atisara. Next slide please. Yeah, so this is the next slide, that is the neurodegeneration. So here we are going to just replicate it into a form of a chikitsa, that we can give a basti or we can give a panch karma in form of the several grutas which has been explained by the acharyas in the text. So Alzheimer's disease, which is a kind of a neurodegenerative disease, it is similar to that of the Smriti Bransha. PD, that is Parkinson's, may be represent with the Kampavata, autism spectrum disorders like Unmada, and ADHD is the Dhruti Smriti Vibhransha. So we can make out that the Gruta Kalpanas, which we are basically using into all these types of vikaras, these are helpful for the regeneration of the neurons. That is the Mastulanga Majja. Next slide please. Yeah, so this is the Samprapti of the Manasa Vikaras. So basically here two modalities are involved. The one is the doshaja, that is the Sharira doshaja, and the second one is the Manasik doshaja. So when there is some psychological stress like Atatva Abhinivesha, Pragna Parada and Parinama, along with the Mita Ahar Vihar Sevana, it lands up into Mandagni. That is the Roge Sarvapi Mandagni. So Mandagni will be there, that will land up into Amutpatti, and definitely there will be improper formation of the Ahara Rasa. So that will definitely affect the Hridaya, and along with that the three important causative factors of the Mana Vikaras, that is the Atatva Abhinivesha, Pragna Parada and Parinama, that will land up into Visheshan of the Manas. So it will land up into Visheshan of the Oj as well, Vyan Vayu and Avalambaka Kapha along with the Rasadi Dhatus. So it will land up in all the Manovikaras. Next slide please. So there are three important chikitsa, that is the treatment modality that has been explained by the Acharya Charaka. The first one is the Deva Vipashraya, then Yukti Vipashraya and Satvajaya Chikitsa. So mainly the Deva Vipashraya and Satvajaya Chikitsa are the Adravya-bhut Chikitsa. Next slide please. So Yukti Vipashraya Chikitsa, here the main focus is to the pharmacological line of treatment that involves the prevention and the mitigation of the disease. So basically it is acting on the three mala, sapta dhatu and the three doshas and the two rajasic and the manasic, rajas and tamas doshas of the mana. Next slide. So here there are basically divided into three, that is the Anta Parimarjan, Bahir and Shastra Pranidhana. The first one is the Samshodhana Chikitsa, where we are using a different line of modalities of Panchakarma like Shirodhara, Shirobasti, Shiro Abnasya, Anjana, because the Mastulung Majja is the main seat for the this treatment of the Manasak Vikaras. The next one is the Samshamana Chikitsa, that is the palliative care. Next slide. So these are some of the enlisting of the drugs which are used for the treatment of the manovikaras. The first one is the Brahmi, Ashwagandha, Shankapushpi, Yashti Madhu, Jyotishmati, Kushmanda, etc. So these drugs are basically used in Ekari form Kalpana or in Gruta forma or in Asa Varishta forma because they are having a Tikta Rasa Pradhanata, because it is basically acting on the Vata and the Pitta, and the formulations we are using in the Gruta Kalpanas. So Gruta is basically lipophilic in action, and it is having a good Sanskara Anuvartana, this property. So basically for these two reasons we are using the Gruta Kalpanas and this particular type of drugs for the management of the manovikaras. Thank you.
Thank you, ma'am. Judge, please note, time taken was 5 minutes 50 seconds. I ask Dr. Vijay Kumar sir to appreciate Dr. Navneeta Sen Gupta with a certificate of appreciation. I call upon the next presenter, Dr. Nandini R, onto the dais.
Namaste, everyone. My name is Dr. Nandiniar, Associated Professor in the Department of Kaya Chikitsa in Dr. NAM Ayurvedic Medical College, Ankli. So my topic is an Ayurvedic perspective of neuropsychiatry. Next. So neuropsychiatry is an interdisciplinary field of medicine that deals with the diagnosis, evaluation and management of mental disorders resulting from the neurological conditions. So these are account for the 13% of the global health disease burden. So they have a significant impact on overall health, quality of life and economic and social implications. As conventional modality of science having several limitations like partial efficacy, side effects of the medications and risk of addictions and withdrawal symptoms. So our Ayurveda have ability to overcome all these limitations and we have a very good scope in treating such kind of disorders. Next. So mind-body connectivity and influence of Tridosha and Triguna on physical and